I had wanted to write my paper on Indigenous health care, but I'd found that too broad a topic, so I've narrowed it down to Indian hospitals. In the first slide, you will see a picture of the former Charles Camsell Hospital, located in Edmonton, Alberta. The federal government did not have an official policy on healthcare for the Indigenous population. The Minister of National Health and Welfare, Brooke Claxton, made the following statement in 1946. Neither law nor treaty impose an obligation on the Dominion government to establish a health service for the Indians and Eskimos. However, for humanitarian reasons, and is very necessary to protect the rest of the population of Canada, it is essential to do everything possible to stamp out the disease at its source, wherever it may be within the confines of the country. Indian hospitals were based on the parish system, or sometimes called the missionary system. The establishment of these hospitals allowed segregation, which was similar to that in residential schools. The original purpose of the Indian hospitals was to address the spread of TB, which was sometimes called the Indian disease or Indian tuberculosis. Indian wards and later Indian hospitals were established to protect the settler population. Indians were dangerous to the mainstream population, so these wards needed to be entirely separate from mainstream populations. Formal Indian hospitals were started in the 1930s. These numbers quickly grew over the next 30 years. The system had approximately 2,800 beds devoted to Indians. Within the hospital system, there was no offer of traditional Indigenous treatment, and there was very little attention paid to culture or treatment of their language. Often the staff who worked within the hospital spoke English but did not speak any of the native languages. The hospitals were a practice of racial segregation for the population. During the post-war era, the numbers of hospitals increased greatly. At their height, there were 29 government-funded hospitals in operation. The conditions within these hospitals were poor compared to those of their counterparts, being often understaffed, underfunded, and having underqualified staff. The wards were overcrowded with no separation between children and adults. Patients suffering from TB were not isolated from other patients. Often unnecessary surgeries, which resulted in permanent disabilities, were performed. Due to the underfunding of these hospitals, there was not proper anesthetic offered to the clients. There are many reports of forced sterilization while hospitalized. There have been published studies that demonstrate there was testing done on Indian patients without consent. Not having yet achieved the status of persons under the law, never mind citizens of Canada, they were susceptible to quarantine or incarceration at the whim of doctors, Indian agents, or government officials. Declaring individuals contagious was a good means of control, keeping them out of trouble or out of circulation, while the task of clearing land was underway. In 1953, there was a change to the Indian Act that included the Indian Health Act. Under the Indian Act, natives can be forced into quarantine. Indian people were not considered people under the law and were not allowed to leave the hospital under their own power. The patient did not have the opportunity to participate in their plan of care or treatment. During the 1970s, the government started to defund and close hospitals. The people of Treaty 6 challenged the closure. Although it was recognized that the care was substandard, the choice to close services without replacement was challenged in court as a violation of the treaty rights. Treaty 6 won in court, but the decision was later overturned. The Indian hospital system has left some people with a distrust of the medical system and has resulted in intergenerational trauma. In 2018, a class action suit was launched against the federal government, and to date there is no resolution.